Hi, I'm Dr. Steve Vargo, and I'm really thrilled to be a part of this. Cooper Vision and iDoc have teamed up to bring you this limited series focusing on myopia management and how practices are incorporating MiSight into their patient offerings. We're going to have candid conversations and hear what works and maybe what doesn't, all intended to give you insights to take back to your practice. So today I'm joined by Dr. Kelsey Guth from Colonial Eye Care in Williamsburg, Virginia. So Kelsey, thanks for joining.
Thank you. Thanks for having me.
I'm curious what attracted you specifically to the area of myopia management.
I would say like my myopia management pretty early into practice became important to me. I was a quick adopter into this because I was that typical high myope that started needing glasses around age 8 or 9. And so it's a little harder to discuss in general how I became interested in the whole profession. I found out I was myopic. I was a gymnast and I would run down the vault runway. It's at the end of the long runway, and I would slam right into the end of it. And so it was because it wasn't clear for me until I got really close to it. And so that kind of led me into needing glasses and developing that relationship with my optometrist. I saw her every year. She made my vision a little bit better. We developed rapport, relationship, but I would have loved to have an option that could have slowed the progression down and truly improved my quality of life growing up.
I hear that a lot with people who treat myopia management, and maybe it's not unique to this particular specialty, but a lot of doctors who prescribe myopia management have told me a similar story as yours, that when they were a child, they, had progressive myopia and wished there was something that could have been done. Do you feel like that helps you better connect with the patients? And in this case, probably the parents, you're talking with them a lot as well. When they have a child that you can probably see back into your childhood and look back on things that maybe could have been done that we can do now to help these kids.
Um, I think definitely it helps to be able to connect with them. I don't think that you have to be able to connect on that level, but I think that it comes across very earnest for me because I truly feel and believe this and wish this for myself, or wish that I could have done that. And now I am in a position that I have children and I have ways to try to slow down this progression.
I think it's something we can all relate to as well. We all know somebody who's got a high level of nearsightedness, and it probably helps the messaging come out much more authentic when you talk to parents because you've experienced it. And do you find that that's something that is easier to talk about and maybe even comes across more natural than some other things? Doctors always struggle with this somewhat of an aversion to feel like they're trying to either push a product or sell a product. And we like to look at communication in terms of how do we communicate the value. Do you feel like that just comes across more naturally because it's something that you've experienced yourself?
I think so. I think I can explain to patients the things that I do, that I did wrong, maybe that I wouldn't have done looking back on when I go over visual hygiene with patients, whether the patient is nearsighted yet or just barely nearsighted, not quite nearsighted, but there's risk factors. I can kind of go through what I call visual hygiene. I say when we're doing near work, we need to be taking frequent breaks, looking far away, utilizing good reading, like working distance, and utilizing good lighting conditions. I will bring it back to me. And I was like, when I was little, I would read my Harry Potter book in the dark with my head on the book. And that's because I could. And then I was like, looking back on it, that's absolutely probably not the best thing that I could have, should have done. It's great to love reading, but there's ways to approach it a little bit. And so I think that being able to connect with my own stories or my own mistakes or how we can do this again, it's almost like every time I see another child, it's like, what can I do better this time that I didn't do for myself?
Yeah, ultimately, I think we all want to connect when we're talking about different treatments. Have you found anything beyond you mentioned telling your own story? You want to impact children. I mean, that is the goal of prescribing myopia management, to make a difference in the lives of kids and their families. Is there anything that you found in terms of educating them that just really resonated, that causes you to go, oh, that really connected with the parent and I drew them in and now they are interested?
I think that having the conversation early, maybe even before myopia has onset. A lot of times I see 5 or 6 year olds with like low hyperopic reserves, or maybe they're minus a quarter. They don't think they need any glasses yet. Both eyes, they're still 20/20 OU. I try to explain. It depends if I've seen the patient before and if I see progression happening already, or if this is just a baseline for their first exam. But trying to connect about what can happen and that we can become more nearsighted and it can happen quickly, and stressing the importance of the earlier that we kind of act on this, the greater benefits that we could have. And at minimum, following up in a 6 month interval to be able to recheck the prescription. And if it is in fact changing, I've seen that to be powerful with a parent and a family, and then quick to take action. Even if they didn't get glasses that first time at all, they said, let's just keep monitoring. It's fine. Once they've seen an amount of progression, whether that was 6 months later or that's 6 months after that, I've had patients and parents that are like, okay, we're ready for MiSight now. It wasn't even like, now we're ready for glasses or to approach this whole thing. They were ready to kind of jump in, which has been, which was good.
Yeah. So there's some planting the seed initially. And I would imagine it's a different conversation for somebody who hasn't shown that progression of myopia yet versus maybe a parent who's more attuned to their child's glasses getting thicker and thicker every year and more eager to find a solution. Is it a different conversation than for the situations where the kids might benefit from a myopia management, but you haven't really seen that maybe more extreme progression of myopia?
I think it depends a little bit on the parent and if they are myopic. Honestly, they don't have to be high myopic. I feel like to for this to resonate with them. I have so many patients that are like a minus 150 or a minus 2, and they're just like they think that this is as bad as it gets. It's as blurry as it gets, and like they never want that, and, which is not true, but also helpful for the conversation of them understanding like it can be worse than this. It can get a lot worse than this. We should do something. We don't want, them to be worse off than you were. And I think that helps.
I was thinking about something before. I'm about a minus 150. So I
Mhm.
know that feeling. It's not that bad, but I used to hear that all the time from parents or from patients as well, that they would talk about how bad their vision was. And then you would do lensometry and you'd look at them like, okay, it's not that bad. But I don't know a world where I'm a minus 8 or a minus 9 and I take my glasses off and I lose everything. But there are a lot of people out there who do experience that. And I think that we have to approach this as I think we have to take this serious as well, because we have to look out and make sure that our parents know about these treatments, because we could be
Right.
preventing somebody from getting to that point. And I think that you said you were
I'm like a -6.
a
So
minus 6. That's pretty fuzzy, right?
yeah,
Without
it
the glasses
reaches
on.
high myopia there, a little astigmatism. So it averages out a little over, a little under, depending which eye. But I do think it's powerful to show that myopia calculator that demonstrates the amount of myopia, and what different diopters of myopia look like. So a parent can see what that looks like to them if they haven't been able to see that. And I haven't done it in a long time, but being able to put plus lenses in front of the parent for them to be able to see what the opposite of that looks like, which is kind of how a +4 in front of your eyes is going to be how that -4 myopic patient is going to be seeing things, and letting them look down the hallway and kind of see how that feels. And it can be like pretty powerful and humbling. I haven't done that so recently. It really depends on if the parents are understanding or trying to understand, or definitely don't understand what their child is experiencing. So
Yeah, I'm glad we're having this conversation because that's a great point. I think it probably benefits doctors to experiment with different ways of trying to communicate this to parents. And that's a great example of putting lenses on them to give them that experience of what it would be like and what we could potentially prevent in their child. I think it's always powerful to hear how treatments can make a real difference in patients' lives. I'm curious if you have any success stories from your own practice where myopia management had an impact on a child or their family.
Sure. So a little bit about my story with myopia management that I didn't mention before, but I started doing it pretty early. I was on maternity leave in 2020, and that was when the MiSight lens became FDA approved. And so I became certified for fitting that. When I got back from my leave, I was fitting it. And so I really feel that MiSight itself had been like a big game changer in my practice, and that FDA approval for that smart, safe, I mean, for a safe, easy way was a big game changer. So a couple of my success stories are kind of related to that, I would say. Thinking of one of them, I have a mom, -10, high myope, has peripheral retinal holes. So have the conversation with their child and them when they're a little nearsighted. Maybe we're in the -1 to 2 range, I think. Totally jumps on the idea of myopia management. Wear the MiSight lenses, learn how to put them in, take them out. And then I've seen him for 2 or 3 years, and really we've held steady. I don't know if we've changed a quarter step or something maybe over those 3 years, but it's been quite significant and really impactful. And mom has been just thrilled with that.
And I think as we continue to treat this as the treatment itself continues to gain popularity, that more of those patients will go out and talk to other people. A lot of times these things grow through word of mouth, both locally and I think we hope nationally that there'll be more people out there talking about it. Um, you mentioned a couple words before I want to circle back to safe and easy, because I think those might be two things that get in the way of parents being willing to move forward, and even doctors from that standpoint. So, over the course of my career, I've seen almost every treatment that we provide evolve and improve, and myopia management is no exception. But even with advancements, myopia management has traditionally been seen as simple, but not necessarily easy. There's a lot of nuances and complexities that can affect the outcomes we get. But MiSight sort of made it easy. I think they made it easy for the doctor and they made it easy for the patient. So I'm curious if you could expand on that a little bit. How has MiSight made it easy for both you and patients?
So it's a daily disposable contact lens. So, aside from the education that I feel is necessary to talk with a family about myopia and the benefits of myopia management, it's really as easy as every other patient that we're fitting in a contact lens daily. So, it's easier to feel confident in the lens because it's a daily lens. So, the safety for young children when we're putting them in the morning and throwing them out at night really keeps the risks low. So it just seems like there's not really a reason not to do it. I do try to set expectations with the family that an 8-year-old learning how to wear contact lenses for the first time, I don't try to pretend that there's not a learning curve. I like to set expectations that there's a learning curve. And once we get over that hump, you learn how to become a good contact lens wearer, usually at about a month, and then it becomes second nature. And it's hard to remember that time when it was difficult. I don't always share, sometimes I do with patients that I remember when I learned how to try. I was 9, and I think finding a different doctor that would allow me to wear contact lenses. So I was going to the doctors to be, please let me wear contact lenses. I'm a gymnast and I'm falling on my face and I really need these. And so I finally found the optometrist that I was working with. But I remember when I had gotten home, I'd be putting in my contact lenses and frustrated that it took longer than I thought it should, either getting them in or out. And then I would cry and my eyelashes were wet and then I couldn't hold my eyelids open and it made it a little bit harder. It depends on the person. If I get that they're a perfectionist like I was, I like to relate that like that's totally normal to become a little bit frustrated. But once we learn it, it is so easy to put them in. And so as a daily lens, you're putting them in the morning, you're throwing them away at night. So it's one more step in a daily routine. Obviously, you're washing your hands before you do that, but it's the same as when we're washing our face or we're brushing our teeth and we're going to the bathroom before we go to bed. It's just so it really is as simple as that. And It's also easier than getting new glasses 2 times a year because your prescription keeps changing and it won't last through the year.
Nobody believes in kids, even doctors sometimes. Because I remember that too. I wanted contacts, and the doctors saying that you're not old enough to get them, you're not responsible enough. And we hear that a lot from parents as well when it comes to contacts. Like,
Mm-hmm.
oh, we like to say we believe in our kids, and then when it comes to contact lenses, it's like, she's not responsible enough. He's not going to take care of him. He's not going to be able to get him in. But I like your approach. You set a realistic expectation, but you didn't cut off that possibility at all. Kids do hard things. I mean, kids do hard things, and I think when we've got, with a lot of parents, there's a concern that certain treatments like contact lenses will be complicated or difficult to manage. And I think a lot of times even parents underestimate their kids' ability to do hard things. So I like your approach with that. Myopia management is so much more about just vision. It's about really making a difference in a child's life. So I'm curious, how has offering this treatment impacted you as a practitioner? What impact has it had on you in providing this care and seeing the positive effects that it had on your young patients and their families? Obviously, it impacted you as a child. I'm curious how it's impacted you now as a practitioner.
There are so many benefits to wearing contact lenses just in general for sports or athletics, cosmetic if people don't want to be seen wearing glasses. But now the fact that there's like a therapeutic benefit, it makes it so much more important. And the other things still hold true, but now wearing these, it's changing the trajectory of the health for the patient and for children's eyes. And so we leave the possibility open for PRK or LASIK if that's something that they want to do when they're older. We don't feel as debilitated without our correction as we would if we were more nearsighted. And so it makes me feel really like proud to be part of such a significant change in the lives of so many individuals. As we know, there's so many patients that are myopic. And so we know that the prescription can continue to change, but I can feel very confident that it's doing so at a slower rate. And really every diopter of progression that's slower is such a significant difference.
Every business has a brand, and you can either drive that brand or it happens by default. But myopia management would actually be a big part of your brand, I assume, in terms of it's going to draw in more kiddos and pediatrics. And there's a bit of a novelty to it in the sense that a lot of people aren't familiar with it. So where this question is going is your staff involvement. So it's not just you, but you have a staff as well. And any brand is really dependent on the team making it work and delivering on a consistent message. I'm curious how what approach you took to training the staff, and was that a difficult transition when you implemented this into your offerings?
It's a good question. The way that our practice works, we have four doctors in this private practice. 3 of us are seeing patients at any given time. And so we have worked towards establishing teams because we all have a little bit different emphasis. And I am residency trained in pediatrics and vision therapy. So peds is my emphasis and what I like to do. And so I've tried to stack myself with a team that understands kids, that wants to see kids, which makes a huge difference because we have another doctor that does low vision, another doctor that does more disease or specialty contact lenses. And so everyone does a different thing, but having people that already wanted to see kids in general is really helpful. One of them has a very myopic daughter herself. And so she already has that connection, but being able to make the kids feel comfortable in an exam room, exam chair, in the contact lens insertion removal hallway makes a really big difference. I watch them, I see them connecting with them, making progress on how to get the lenses in and out. And then when it comes to ordering MiSight lenses and doing things like that, I know that I have my team that knows that they're looking out for me and able to answer other questions as needed. I try to have one person at least at our front desk also that kind of understands the booking, the scheduling of the appointments and stuff, because we usually allow a little more time for an insertion removal on a MiSight patient that's coming in specifically for that. And with that plan, we always come in with a like, this is going to happen. It's as long as the child's on board to wear contact lenses. If there's any hesitations, we're able to kind of talk through those. We just explain that, like, when we get them in, not like, sure, it might take a little longer. Sometimes we bring someone else back for practice, and that is totally fine. But the ultimate goal is we're going to have them in. And so we work towards that. And I think having that like positive outlook is really helpful and keeps determination for our patients too. And I think that my staff does a really good job kind of reiterating that and pumping them up and getting them excited and approaching new ways if one of the techniques doesn't work well for them. And so I'm really grateful for the staff that I have in that regards.
You know, I've heard a lot of doctors who prescribe myopia management tell me that they were getting to a point where they were getting a little burned out with routine care, and myopia management brought joy back into going to work. I was reading about professional burnout, and for doctors, it's really off the charts. And I think the thinking is typically that we need to get away from work, less days seeing patients. But actually, what they found was one of the best way to actually reduce professional burnout for doctors was to start practicing in a way where we felt a sense of purpose again, and we felt like we were making a difference. And you mentioned that before, making a difference in the families and lives of the patients. So I commend you for doing that. And I know it's a journey, and I hope more doctors hear stories like yours and continue to explore this treatment of myopia management. And if there's more of us doing it, more of us making a difference, more patients talking about it, I think we'll, as a profession, continue to make a pretty profound difference for the, a lot of those kids out there who someday won't be kids. And maybe we can have them back in our practice without glasses on, and they'll give you a big hug because you made a difference in their life. So thank you so much for sharing your story with us.
Absolutely. Thank you so much for having me.
Well, thank you for watching. With that, we'll close out. Thanks again, Kelsey, and thanks Cooper Vision for sponsoring this event.